Hello there, my name is Nancy Burke, and I am pleased to bring to you a presentation on seeking employment in public safety. I have been fortunate to be an athletic trainer with a variety of experiences over my career. I have spent 28 years in a high school setting and then was able to move on to 12 years with a large county public safety police department. I specifically worked 12 years with the Fairfax County Police Department in Fairfax County, Virginia. All the stars lined up for that to happen. And hopefully with this presentation, you'll be able to line up your own stars. Enjoy! This is a presentation involving a three-part series relating to those who are interested in seeking employment in the public safety setting. It's divided into three sections: the introduction, formulating the plan, and then moving ahead. The introduction introduces athletic trainers to the public safety setting. Formulating a plan provides starting points in creating and developing one's business plan, one's action plan, or strategic plan. Typically, this is not something we athletic trainers were taught, so this is helpful to give a starting point to those who need a little push to get on their way. Moving ahead, we're going to take a look at some more specific strategies and tasks for the athletic trainer that will help move one into making an approach to a representative of an agency and get the first meeting, and then move ahead, hopefully, to a contracted or full-time employment in public safety. In part one of this presentation, we'll take a look at these educational points. What is public safety? What are the public safety athletic trainer general daily job duties in a clinical setting? The collaborative wheel for the athletic trainer. What are common injuries and illnesses of public safety? What are athletic trainers' concerns regarding employment? What are concerns of employers regarding injury and illness of their employees? And then to define the road to take farther. Let's get a handle on actually what is public safety. Public safety are those employees who are tasked with taking care of the citizenship in a local area, a county area, state area, or on the federal level. They are police officers, sheriffs, peace officers, corrections officers, they are firefighters, and they are EMS. All of them have very active athletic style occupations. All of them have to be operationally ready to respond at a drop-dead moment. These are individuals that the expectation of the public is that they will be fit enough to be able to rescue them or care for them in time of an emergency, whether it is man-made or a natural disaster. As I said, the settings may be local, such as a township or a city. They could be in a county, state, or federal. We do have athletic trainers working in most of these settings. On the federal level, they are working with, in law enforcement, they're working with the Federal Law Enforcement Training Center in different areas on the East Coast and also out in the West. In terms of hiring for law enforcement, interestingly enough, 70% of firefighters are volunteer firefighters. Only 30% are paid, and that has implications for the athletic trainer positions. The paid firefighters, their cluster is usually around urban and suburban areas, and the unpaid volunteers may support suburban areas, but they're also in the more rural areas. 100% of law enforcement is paid. So again, just keeps in mind some implications for hiring a paid full-time athletic trainer in a particular agency. Athletic trainers currently employed are employed as an embedded athletic trainer. They're actually part of the department. Their contract is with a department, employed at training academies. There are some employed as an independent contractor. Not too many are employed at this time as an outreach athletic trainer from a clinical or hospital setting, although I know there are many interested in doing that. The catch is that this is not really a job where the agency will be interested in making money for the clinic or the hospital. They're interested in reducing their costs for medical and overtime costs and also keeping their people on the job. So just a little background there on the public safety employee. The public safety athletic trainer daily job duties are very similar to those in a clinical setting for a high school, collegiate, university athletic trainer, or one working in amateur sports. All of the same jobs and duties. They are really no different. The sprains, strains, fractures, dislocation, the care plan is the same, just the setting and the incident may be different than what you're usually used to, such as an athlete may be sprinting a 200 meters and on the turn they pull up with a pulled hamstring, whereas an officer may have been sitting in a van for hours and hours and then opens the door and takes off on a sprint to capture a bad guy dealing drugs. Same injury, different situation, but we are really good at taking care of injuries. This chart shows the relationship of the athletic trainer with different entities in a fire department or a police department or a sheriff's office. Depending upon the size of the agency, you may or may not interact with all of these people. But the larger the agency, the more lines there are to the wheel, obviously, and then the smaller the agency, the smaller the lines of communication would be or are necessary. So starting off at the top, you have the department commanders or the academy director. And these are individuals who are responsible for the claims, the injury claims, the money, how much is spent on overtime, how long an employee is going to be out, whether they should be put on medical leave, for how long. And they handle the nuts and bolts of injury. And they also collaborate really well with the athletic trainer to find out what is the cause of some of these things and how can we prevent the causes. A medical director may be a volunteer position in some agencies, or in larger departments, they may have an actual office of the medical director, and this is a paid position. Safety officers are very common with fire departments and some police departments. And these are individuals who are firefighters usually, or police officers, deputy sheriffs usually, who assist with making sure the scene is safe at an incident, a huge fire, maybe a huge public safety incident, and they make sure that environmentally the employees are safe as well as actually for mechanical reasons that they were safe. Third-party administrator, this is the company that works with the employee to make sure that they get to their physician visits, therapy visits, that bills are paid, and work very closely with the athletic trainer in helping the employee to recover. Incident support maybe in some agencies, not in others. These are adjunct professionals who work to support the employee. It could be the chaplain service, could be department psychologists, could be nutritionists, registered dietitians, could be a number of different people who are either volunteers, maybe in a part-time or full-time contract, depends on the size of the agency. The workers' compensation panel physician is required that all agencies have a panel of physicians, and if an employee is injured, this is the panel that the employee seeks care. Treating physicians would be for those injuries that are sustained outside of the workplace. So sometimes an athletic trainer can take care of employees who are injured off the job because that affects their ability to return to the job. And in that case, the athletic trainer should have the employee complete a HIPAA form, which they take to the treating physician, and that allows the athletic trainer to communicate back and forth with that treating physician. Some areas may have an occupational health services area, which is staffed by occupational health physicians as well as PAs and nurses, and they do a lot with treating environmental injuries as well as exposures. May provide annual physicals to the employees. It's a variety of different care that is set up between the agency and the occupational health program. Obviously, the injured employee, the athletic trainer has great contact with. Supervisors of the employee, the athletic trainer has contact with them, and primarily that is to make sure that the supervisor is aware of how the employee is progressing, what their timeline for return may be. Injury information is somewhat closed to the supervisor. If the injury occurs off duty, then the supervisor cannot have any information about that injury other than what the employee agrees to let the supervisor know. And then we have our human resources and our risk management, and these are the group which is usually the county or city human resources or risk management, and the athletic trainer works with them to manage the workers' compensation panel physician list, help mitigate traumatic events in terms of what happened, what caused it, and how can human resources make some changes in that. And they are also responsible for managing the athletic trainer's work contract and salary. So it's always good to get to know human resources. Common injuries and illness in public safety. Overwhelmingly sprains, strains. By far, when you look at the data for law enforcement injuries as well as firefighter injuries, overwhelmingly the number of sprains and strains are huge, and that's what takes the employees off the job. That's our bread and butter. That's our meat and potatoes. That is what we do. You will find a number of overuse and repetitive motion injuries, obviously wound care. The athletic trainer does a lot of general medical assessments and referrals, and then of course good old concussion. So this is our toolbox, this is what we do, and all of this is similar to any athletic training setting. Lots of resources available to get injury data if you need that, if you're going to make a pitch for a position. A lot of injury resources are available to show that the common injuries are perfectly set for us to help be able to treat. And I would get out there on Google and use keywords such as police injury data or firefighter injury data, and you'll find a lot will come up. So athletic trainers entering into the public safety setting. This is a tough setting to get into because it's not an established setting. The athletic trainers who are working in the settings have made their job happen. Each one of them had a vision, and each one of them worked extraordinarily hard to create their own position, and it took months and months, and in some cases a couple years. Their success is based upon their experience. These are experienced athletic trainers who have been independent workers for a few years. They have done their own budget. They have done their own collaborating. They may have set up their own clinic. They have got great connections with physicians in the area, as well as perhaps with firefighters or police officers. Some of them may have a relationship with a firefighter, police officer, a family member, husband, wife, significant other. Some may have family members that were in law enforcement and firefighting years ago. Some may just talk to police and firefighters in the area and have gotten an interest in finding out what kind of common injuries that athletes in public safety has. Some athletic trainers have been approached by firefighters, and law enforcement has approached athletic trainers to find out, hey, I've done this to myself, how can you help me out? So it's just a matter of having that experience, having those relationships has been very, very helpful. Working towards a position requires a great deal of self-discipline, self-determination, requires the athletic trainer to get out of one's comfort zone, to do some planning and researching, developing your plan, which is not something we're really used to doing. Requires advocating for yourself, not only as a person, but as an athletic trainer. As the chief said when I entered into his office to convince him that the department needed an athletic trainer, he said, you had me when you walked in the door, but how can you save us money? And that's what I had to document for him. The last part is you have to advocate for employees' health and wellness. And again, as athletic trainers, we're experienced in doing this. So athletic trainers' concerns where can I find employment? As I said earlier, you have to go out and look for it yourself, find your spot, start researching. Skills to add to entry-level skills. We get a great background in athletic training skills. But if you have not gotten experience with any soft tissue mobilization, I would recommend you do that. Perhaps a weekend ergonomic class, because the places where these people sit, like in a cruiser, which is their desk, these are horrendous, and that ergonomic settings would be helpful for you. And then perhaps some muscle energy would be good. Experience, as I said before, you need experience. Unfortunately, sorry, this is not an entry-level athletic training position. And no, your internships don't count when you're applying. You need to have good, solid, independent working as an athletic trainer, utilizing a lot of your skills and getting your confidence level really high. Any summer or semester internships available? Contact your local universities and see what they have, or contact your local police department or fire department if they have an athletic trainer working with them. See if you can work with that athletic trainer to form a relationship with the university. Or if it's a summer program, see if you can, summertime, see if you can work out a couple months where you can go and visit, shadow that athletic trainer. I think your eyes will be opened, and it'll be a great opportunity for you to get some background. Concerns of the employers regarding injury illness. The employer wants to keep the employee fit and on the job. It's money. The more officers that are off the job, the more that compromises public safety. The more officers off the job and the longer the length of time they're off the job, it requires time and a half out of that budget. And that's a lost work product. So it's to the employer's benefit to get that employee back to work. Let's take a look at the road you want to travel. The first thing to do is to check your State Practice Act. What does it say? Can you work with the active person, or are you limited by state practice to practicing clinically with a set high school, collegiate, professional athletic team? And as I said here on the slide, this will determine your scope of practice in public safety. So just because your state won't allow you to do clinical practice, it doesn't mean that you have to stop. You can also do health and wellness, lectures, practices, practicums, all kinds of little group activities for your public safety athlete to improve overall health and wellness. And then hopefully working with your state legislature, you and your governmental affairs group can change the State Practice Act. Define what you wish to offer before you make your approach to having a athletic trainer in the agency. Do you want to do health and wellness, strength and fitness, injury prevention and recovery? Define your terms before you make your pitch. Don't go in saying, what do you want me to do? I think I can help you. And they just know you're not sincere. You need to have a balanced approach. Here I am. Here's my credentials. Here's what the state practice is. Here's what I can do. Here's how we'll cut your job costs for medical payments, workers' compensation costs. Here's how we'll cut your overtime payments. Be prepared. Know what you want to do. Know what your scope of practice is, and then you can be successful. Let's move on to part 2, formulating a plan. In this section, we'll get down to some details of your preparation to make an approach to a public safety agency. You'll need some notebook paper maybe, or a pen, but you'll want to just start looking at how you objectively can advertise yourself and promote yourself to being an athletic trainer in a really wonderful setting. Here are the educational points for this segment. We're going to take a look at the definition of a mission statement, the definition of an action plan. We're going to define SMART goals and how they apply to each of the tasks that you are going to be seeking. We have a sample action plan, There are some overarching questions that must be answered before you get too far along in your plan. We'll take a look at some sample tasks, and then we'll get you started on writing your business letter proposal by giving you some tips for that. Every business plan needs to have a mission statement, and this is not an easy job. You need to define what you want to do, what are you going to achieve, and what service you're going to provide in only a few words, and it has to be clear and concise and to the point. This example that I have here, improve the health, fitness, and longevity of the public safety employee using evidence-based sports medicine principles, is an example of a type of mission statement. Make up your own, or you can use this one. The point of this example is it gives you a lot of leeway on how to continue your practice or how to develop your practice. So you don't want to have a mission statement that really limits you in what you want to do. Rather, you have one that gives you a large scope of activities that you can do to fulfill your mission, which basically, again, is to keep that public safety employee on the job or prevent them from getting injured in the first place. It is extraordinarily difficult to take on a goal of starting a program in public safety without having a roadmap of how to get there. The action plan is the way to do it. It helps you set up a detailed list of activities and tasks that you can complete in order to be on your way. SMART goals are great for keeping clarity when deciding on goals or tasks. Simply put, they help keep the planning focused and the individual on target. Specific goals are focused and clear. Measurable goals, whether or not the goal is completed. An attainable goal is achievable. One may need help, and that's okay. Don't let the goal get too complicated and set yourself up for failure. Keep it simple. A relevant goal, does it relate to your goal of achieving a position? And also, does this relate to your life plan? And a time-bound goal, set your target to complete all of your tasks. Sample action plan. Action plans are pretty generic. One can find others on the internet, or perhaps from classes that someone has made and taken, or perhaps from another athletic trainer, or from workshops or presentations that you have been part of. We want to start off with a goal, a long-term goal, which is to gain employment as an athletic trainer. You're going to make a list of tasks. You want to brainstorm a zillion tasks, write them down, and then you can weed out the ones you need and add ones that you may find more specific. You're going to prioritize the task. You're going to develop a timeline for each task. You're going to look at resources that you need to help you making the proposal, and you're going to review your progress along the plan about every 2 weeks. You want to check off those are completed and revise your plan. Don't throw away your earlier plan, because it's amazing how many times you may need to refer back to that. So your ultimate objective is developing the business proposal, and a good action plan and a living document action plan will help you get there. Before we get too much farther, there are some overarching questions that need to be answered. What type of athletic training position is being sought? Is it full-time, part-time, contract employee, agency employee, outreach? In my experience, I have found that the agency employee has the best benefit, not only to the employee, but to the agency. Keep in mind that the agency's main goal is to reduce medical costs, and their secondary goal is to keep the employee working. Where are you looking to be employed? At a training academy, a station, a separate facility that is still part of the agency? What public safety entity are you looking at? Fire department, sheriff's office, police department, EMS, corrections? What size of agency? How many employees are you looking to take on? Are you looking at a township, a city, a county, state, federal agency? If you're looking at an agency that has 25 firefighters, that is not enough to sustain a full-time employee. However, if you do a really fantastic job as an athletic trainer with those 25 employees, as a part-time athletic trainer, you may look at expanding your practice. And then look and see if you can form a relationship, say, with the police department or the sheriff's office. And if that goes well, look to see if you can expand to township or city employees. And before you know it, you may have moved yourself into a full-time position. It won't happen overnight. It'll take months, but it can be done. Don't limit yourself. And don't overextend yourself, thinking that you can be the athletic trainer for the New York State Police Department. Sample tasks. What makes a basic action plan personal are the tasks identified which are unique to the objective, in this case, public safety. These tasks are not in any order. Timelines should be specific to the ability to be performed. Gathering relevant injury data, local and national. Put together a business card if you don't already have one. Make relationships with fire department law enforcement officers. Find an advocate to help you move the proposal forward. In my opinion, this will generally be a commander, someone of rank of lieutenant and above. Discuss the plan with your local team, physicians, orthopedists. You'll find that the workers' compensation panel of physicians list is primarily orthopedists, and you already have a relationship, likely, because of your involvement with athletic teams. Use that relationship. Research presentations, papers, articles by current public safety athletic trainers to gain some insight in what they do. Develop an information packet for your proposal about athletic trainers in public safety occupational settings. The NATA has tons of information on this. And then research the agency command structure, the equipment the employees use, what they wear on their body, and what they drive. Research annual medical costs through the Freedom of Information, Public Information Annual Report. And take a look at the employee age range and the number of medical conditions that can occur in that active employee. And again, brainstorm all the time. Jot down your thoughts to add to the task list. The business letter proposal. The business letter proposal is how you start your official conversation with the agency. It's a brief introduction of the athletic trainer to that agency. The business letter proposal is attached to supporting documents for a more thorough picture of the intended position. So to begin with, you definitely want to be concise. This is a one-page letter, formal business style. Be careful about I statements. You want to start thinking about previous work with public safety. If it was paid or volunteer, it all counts. Write as though you're speaking to a real person. Share relevant experiences, an example or two of your work product. And for sure, have your letter reviewed before mailing for editorial changes. And now to the substance of the business letter proposal. Very simple, very basic. Start with the introduction. What are you asking for? Why this needs consideration? What are agency problems your position could solve? 2 sentences, max, that's it. Keep it simple. Make your case. 1 to 2 paragraphs, no more than that. Define athletic trainer. They're not going to really know about you. Sad, but they may not, so you'll have to advocate for yourself and for the profession. Outline the benefits, very short and sweet. Add your significant work experience related to public safety if possible. Share other agencies who have athletic trainers on staff. Don't assume that the interviewer will know all about your proposal or relevant data supporting the proposal. And your ending is to ask to meet to promote further what you would like to do. And this is a sample ending sentence, and you can have fun fixing up your own. And now a couple comments, some summary comments about this section. This is a short section in this presentation, but it is a ton of work. I'll tell you that when I was investigating whether I really wanted to move from a high school setting to a law enforcement setting and to make a pitch, I had to do a lot of thinking. And the first thing I did was to put together that letter, that contact letter, that reach out letter. And essentially my letter said the same thing I've asked you to say, which is, my name is Nancy Burke and I'm interested in talking to you about a position as an athletic trainer with the Fairfax County Police Department. So that was my initial start. And then I gave a little definition, not crazy, but a little definition of athletic trainer and what our skill set was. And then I added in that it is my experience that an athletic trainer could reduce the number of musculoskeletal injuries and return officers to the job more quickly than they were now, based on information that I would be happy to share with them. Where did I get that information? From the occupational health settings. So use the NAT occupational health database to help you get some data to send along, as well as use what the NATA has for public safety. And later on in this presentation, I'll give you some documents that you can use to support your reach out. The other thing I did was ask that I could talk with this person about this proposal, this proposed position. And I received an email back from this person, who was a captain at the time, saying that he would shop the idea around. And I knew that that meant, okay, we're done. But lo and behold, 2 weeks later, he sent me a note asking if we could meet for lunch. So we did. And there's where things got started. You may or may not get a request for a meeting. So after a couple weeks, if you've not heard anything, just reach out by email or by telephone, leaving a message or an email note saying, hey, listen, well, more formal than that, but I haven't heard from you. I'm just wondering if you had a chance to review the information I sent you, and I would love to chat with you. Listing the tasks. I sat down with some legal paper and pretended that I was going to be offered this position. And then I made 4 columns of tasks. What needed to be done right away, what needed to be done if I received the job, and what needed to be done at the end. And the third column were those items that didn't fit anywhere. So the first columns were making contact with the police department people that I thought I could ask about whether or not this would be a viable position, and then also reaching out to physicians in the area that I knew who worked with workers' compensation and worked with fire and rescue and police, asking what they thought about adding an athletic trainer to the department. I also researched areas where I could bring funding in, where there are grants available, where the hospitals that might donate or grant funds to help supply the clinic, where there are groups that would loan equipment out to that program in case we didn't have startup money because we're in the middle of a budget year. You know, if you go in January, their budget's July 1. And I found that some of the local high schools had extra equipment they weren't using, and one of the professional teams did too, so they loaned it to me. So on a task list, as I said, I divided it according to what needed to be done first, what built on something. And so I always had things that I could do, and I would check off that this is completed, this is completed. So when it actually came time for the meeting, I was prepared. And I don't want you to go into a meeting thinking this is going to be like anybody else's interview. Here I am, I'm a live body, you need me, I need you, let's go make this work. It's not the way it goes. You have to be prepared. You have to know what you're getting into. You have to know some of the steps that are done. And as I said, later on in this presentation, we'll go through that. So I just want to make you aware that this, while it seems like a shorter section, is crucially important that you get your paperwork together. Get your CV together, get your proposal letter together, get your task list together. The more organized you are in knowing what you have to do, and yes, it can be overwhelming, but in the long run, you'll be better prepared and able to stand on your 2 feet and make a professional presentation. Now we're moving on to part 3, moving ahead, which gives you a little bit more in-depth understanding of how the process works for hiring. There are a number of educational points that will be covered here. The foundation for the proposal, some background information about the public health community, the public health approach to understanding injury, illness, disease, reinforcing the athletic trainer in the workplace with a public health background knowledge, the first step, the information packet, the introductory meeting, first meeting considerations, questions for the AT work area, who comes to the table for an AT hire, questions for a contract, and determining salary. Before we get too far involved in specific points and tactics to making an approach to a meeting for a position, I'd like to detour a little bit into the area of public health. And this is important if you're in a city, county, or governmental agency as an athletic trainer, because there's a strong relationship between the public health departments and different county agencies, especially in fire and rescue and law enforcement, where there are positions within the departments taking care of exposures and other issues that may be more of a public health concern and not just related to the health of the employee, such as a MRSA exposure. That becomes a public health issue because of need for not just treating the employee, but maybe also disinfection of a facility, a vehicle such as an ambulance, the fire truck, or a police cruiser. That becomes more of a public health thing. So there's an interrelationship between these two groups. And it's important for the athletic trainer to understand that we are very, very interrelated with public health just by virtue of what we do. So we're starting off with that we are part of the healthcare provider community. That's a given. We know we are. We relate so well to other healthcare providers to provide for our employees. Understanding how public health approaches injury and illness gives us a background and a foundation as well to develop policies and procedures for a single position, such as when I was with the police department. It was very helpful to have an understanding of how this works, to develop policies and procedures that had to do with preventing chronic illness or chronic injury or chronic uncomfortable positions with the officer. I'll explain that in a little bit. And this can help us in expanding laws governing athletic trainer practices in expanding our practice because we understand what our role is in public health. So I think you'll find that this sidebar information is going to be helpful for your research into supporting your entire business proposal. It's a broader way of thinking, but that's where we need to be when we're looking to convince someone that an athletic trainer hire is the best for their agency. When we take a look at this graphic from Carroll County, Iowa, we can see the interrelationships of different county agencies that are tasked with maintaining a good public health status for their citizens, as well as keeping an eye out for those things that may become problematic. But also, if you look at this graphic, look where the athletic trainers are employed. Fire, law enforcement, corrections, physicians' offices, hospitals, schools, and there are even some athletic trainers employed in nursing homes. So we are already integrated into the public health model. We just need to embrace it a little more deeply, and that will help assist our students, our citizens, our employees into doing things that improve the public health model overall for the community, promoting healthy lifestyles in our programs. We research what injuries occur in our programs, what illnesses, what's disease. We look at different trends, how these things can be prevented, how we respond. We are truly part of the public health community. The public health approach to understanding injury, illness, and disease is essentially a three-step process: to gather and analyze data, to identify the problem and target groups, and to select strategies to mitigate the condition. So when we gather and analyze the data, we take a look at what is happening, to whom it is happening, when, how, where, and why did this happen. Once the problem has been identified and the target groups that are affected, now one knows specifically the injuries and medical conditions that are occurring, what is the cause of them, specifically to whom they are happening, how they are happening, and what must change. And as a sidebar to that, there also needs to be a look at who is to partner with the provider to make the change. Typically, there are three strategies that public health investigators use to understand the injury, illness, disease transmission model, and they are the 3 E's of injury prevention, Haddon's matrix, and the spectrum of prevention. Different investigators may also take pieces of each one of these strategies and devise their own strategy. For the purposes of my presentation, I'm going to borrow from Dr. Richard Hinton's public health approach. Dr. Hinton is part of the U.S. Lacrosse Sports Science and Safety Committee. Brilliant man, and this comes from a presentation he did on lacrosse sports medicine. So taking a look at the graphic here, we have step 1 on the left, injury, disease, and surveillance. Then we go to the right, step 2, risk factor identification. Step 3, develop potential interventions, potential solutions. Step 4, assess effectiveness. And step 5, implementation, feedback, and assessment. And we may all be familiar with these stages as athletic trainers, because truly this is where we investigate an injury that has occurred and what were other factors that associated that may have contributed to the injury. We develop our solutions, and then we try a solution, a remedy, and then we assess it, and then we give feedback that may set us back to step 1 of, you know how it goes. The more you ask, the more questions, the more research you do, the more questions that come up. But all in all, it leads to a good outcome. So we're going to take this, and I'm going to take you through the stages I used in dealing with low back chronic issues with law enforcement. Early on with my work with a police department, I was frequently asked about how to deal with low back strain, low back pain. And the blame was put on the duty belt. The duty belt is a leather belt that holds multiple instruments necessary for law enforcement officer to do their job. And many of them are required to be on the belt. Officers sometimes will add an additional item, but generally it's on the belt. The belt weighs between 12 to 15 pounds. That includes the handgun and the holster, and includes the handgun being fully loaded. So when I was presented with this rampant low back condition, and how can I as an athletic trainer help make it better? The first thing that had to be done was to identify what actually was the problem and what was the extent of the problem. So we did a couple things. One of the first things was to look at different data that had been collected in different agencies and come up with some numbers as to how much does this really affect a police officer, as opposed to how much does low back strain affect the general population. And we found some interesting information. It was important that I had a data injury surveillance system that I used in my job. And it was also important that I was able to tap into others' injury surveillance that they were keeping to add more information to me. And then, of course, you do the typical PubMed search and Google search to see what was out there. Step 2 in this investigation of low back strain, perhaps related to the duty belt, took a look at different risk factors. The age of the officer, how long they had been employed, how long had they been in a cruiser, was their job simply in a cruiser, or were they a canine officer who was out running around all the day or walking all day? Were they perhaps at a desk job but still wearing the duty belt? And then taking a look at the body mechanics of the officer. What was their actual activity during the day? Were they mostly sitting, standing? What overall were the demographics of this particular condition? And then what may be the risk factor for the duty belt? And we found some interesting little add-ons that law enforcement officers weren't necessarily aware of, and those that may have been aware of them, they weren't actually working to correct them. In step 3, which was to develop interventions and find potential solutions, one of the critical items that we discovered was sitting for hours and hours in a cruiser really shortened the hamstrings, which affects low back. So one of the interventions that was developed was putting out a requirement, unofficial requirement, that every hour the officer had to be out of their car walking around for 10 to 15 minutes. That was one that didn't cost any money, it was easy to achieve, and the officer needed to be out visibly as a community source anyway. The second thing was that we took a look at different duty belts that were available that were not leather and perhaps weighed less than the leather. And we saw a couple items that were available, and we bought a couple to experiment. We did a small study with about 20 officers and found that yes, a lighter duty belt does give some relief, not as much though as the exercise. The third thing we did was implement to those officers a stretching flexibility program. We couldn't require officers to do that, but found that those who are interested in relieving the low back pain, that they were very easy to treat with stretching and flexibility, and then also they were eager to take on this as a home program. So we found that this was quite effective. As far as assessing effectiveness in a controlled environment, for those that wore the modified duty belt that was a lighter weight, yes, there were intended consequences that we wanted to achieve, which resulted in less lower back pain. The flexibility exercises and core strengthening as well did achieve an overall effect on health and safety for the officer. They felt better performing their duties. Were there unintended consequences? Some, in that officers who were in cruisers that had been maybe 10 years old, and yes, they're out there, we found that the seats had collapsed, so they weren't getting any seat support. So an unintended consequence ended up an expense for the department for a new seat, but in the long run, it affected the health of the officer in a positive way. Step 5 of our small study and work to improve the low back health of the officer. The implementation of our programs was a positive thing all the way across the board, from commanders down to the rookie officer. And we felt that the implementation of this did show effectiveness of it. Overall, then the commanders did make a policy for approving lighter duty gear for those officers who requested. And then the athletic training program did make available on a full scale to the entire department education on core strengthening, stretching, and mobility, as well as the benefit of getting out and moving around and not sitting in your desk all day long. And that includes a cruiser, which is their moving workspace. So we wanted them to get out and move. We found that implementing the opportunity for a lighter duty belt was very helpful. And then we went back to measure rates of injury and return to step 1. So ultimately, this gives an idea of how a public health investigation protocol can affect an athletic trainer in trying to improve the health and safety of your employee. And there are multiple avenues for that in public safety. Perhaps taking a look at how the bunker gear in a firefighter affects the environmental illness for heat stress, heat illness, and in the summertime in some of the horrendous heat and humidity areas that we have in the United States. Is there a way to improve that? That's an interesting study that somebody could take on, because you don't want any gaps in equipment to affect entrance of toxic fumes and smoke. All right, moving on. In an earlier slide, I mentioned the ease of injury prevention, which was one of the 3 strategies that may be chosen to focus on injury prevention and identification. And in the Athletic Training and Public Health Summit article in the Journal of Athletic Training by Mark Hoffman and others, their article reinforces the athletic trainer in the workplace by taking these 3 E's and again modifying it to a more appropriate skill set for the athletic trainer. Again, these are skills that we have. We actually actively utilize these skills in our programs. Primary prevention focuses on intervention before injury or illness has happened. This is the same that you would do to a public safety athlete or a tactical athlete. Secondary prevention focuses on intervention immediately after the illness or injury has happened. This is why it's important to have an on-site embedded athletic trainer, not necessarily an outreach athletic trainer. You want somebody that can provide that immediate intervention, get that early treatment, get that public safety athlete to their target physician for treatment. And then the third or tertiary prevention focuses on outcomes for those with long-term injuries or illness, and how can an athletic trainer work with these injured employees to prevent further destruction of joint disease that can actually take them out of their job earlier than they might like to be. So all of the public health models are very clearly applicable to the athletic trainer setting. And this knowledge and this background is going to help in an interview with the athletic trainer in promoting them as a primary healthcare provider for public safety. Now that your head is filled with all kinds of good information about the interrelationship of public health to athletic training, let's take a look at what your first step will be in making your proposal. This is going to be your letter. Here is a sample letter that you can use as a starting point. I don't think I would use the same letter. Not everything may apply to you, but again, it gives you a starting point, and sometimes that's all we need. Now, to whom to send the letter? By now, you should have made some contact with employees of the public safety agency you're interested in helping. Talk to them and ask them to whom you should make your pitch. It should not be the chief. It should not be the mayor of your area, your township. It should not be the governor. It should not be any government official. You want to make the pitch to a commander who's a mid-level commander. These are the people who get the job done. These are the people who see a problem, do an analysis, find a solution, and then put that solution in place. The mayor, chief, governor, they all want somebody to come to them and say, hey, here's the problem, here's the solution, can I make this happen? They want somebody else to do the work and come with them with the paperwork. So make your pitch to a lieutenant or a captain. Do you want somebody that has some relationship with a budget, and you can get them to help assist you on your way? So this is your first letter, or your first step rather, your proposal letter. You don't have to have anything else, your proposal letter, and you're going to send that off to that contact person. Give them a couple weeks, as I said earlier, and then if you don't hear anything, just follow up with an email. That would be appropriate at this time, or a phone call, and it's okay to leave a message just saying, I am so-and-so, I sent a letter and about to the captain or to the second lieutenant, and I just want to follow up and see if there are any thoughts on that, and I appreciate a phone or an email back. That's all you have to do. The second stage of making your pitch is to gather information to send to this person whom you've sent the proposal letter. It's your choice to send all this information at one time, or to pique their interest by sending the proposal letter and then a day or two later putting information together in a packet explaining the skill set and the role that athletic trainers play in injury care and reduction, as well as cost savings. If that's up to you. In your slide here, there are 4 resources for you to utilize. I would suggest that you do use the NATA PDF, athletic trainers, not trainers. I think that's important. Our public safety people are interested in wellness, interested in maintaining fitness, so they do have employees that they have on site who do their functional testing for the job, their physical abilities test, if you will, and they may or may not have taken a course in personal training. So they may be a certified, if you will, personal trainer, but they may not be. They may be just somebody who has an interest in lifting. They've done a lot of investigating in it. They work out themselves. But that can be problematic because those individuals are typically very fit. Perfect. That's great. But their focus may be on the more fit employee, whereas we want to focus on the entire employee, those who are not fit, either because they haven't been doing any cardiovascular work for a while or any strength training or flexibility, or they may be overweight, and that is problematic in their job when they have to run and chase somebody down. So we want to be able to give them an avenue to have a person who's qualified, educated to work with a whole person, not just with those that are getting more fit when they're fit. These pieces of information you're welcome to use, and there's more out there. Do go look at not just athletic trainers in the public safety setting, but look at athletic trainers in the occupational health setting, because after all, public safety is an occupation, and some of the work that's been done in occupational can also help you out. So don't overwhelm this person. Four documents should be enough. If they want more, they can ask you. But the reason I picked each one of these is they have a little different slant on what may be helpful to the person to whom you're making the proposal. Congratulations, congratulations. Now you have an introductory meeting. This is terrific. You received an email or a telephone call asking you to meet to further discuss the possibility of your proposal. This is a meeting where both you and your representative of the agency are testing the waters. So it's very important to be professionally dressed, appropriate attire. I would not, ladies, I would not wear 2-inch spike heels and anything really high and tight. Be professional. Gentlemen, make sure you wear a tie and a jacket. Look good, look sharp, and make sure your shoes are polished. And no sneakers, no tennis shoes. Look sharp. A casual meeting is the best. They may suggest lunch or meeting on a coffee break. That's up to them, and you're totally happy to go. Go with an open mind. You may not really know what they want. They may not know really what you can offer. So go with an open mind and just be prepared to think before you speak, pense a little bit, and then make your statement. Likely your meeting will be with one person, may not be with two. I doubt more than two, because again, this is just testing the waters. Research them as much as you can. Find out much about their background. Were they an athlete in high school or college? A lot of your public safety people were. So the chances are nowadays that many of them have met an athletic trainer, and hopefully it was a positive meeting. Research the agency as much as you can. Find out what kind of injuries they have, how much the cost is for your workers' compensation. You may be able to find that out from previous year's annual report, which should be public information. They will research you in all likelihood. They will look up athletic trainers and get more detail from that. If they know athletic trainers in the area, they may call them and ask about what are their job duties, what do? Do they know you? How much regard do they hold you in? This is not a time for a PowerPoint. Don't bring one on your little notebook. Don't bring one on your phone. They don't want to see it. They just want to talk to you and get a feel for you and what you can offer. This is a time, though, for business cards. Make sure you have them and give them out right away. They will give theirs to you, and you want to hang on to them. Take paper and pen with you. Look professional. If you can, avoid bringing a cheap Bic pen, and don't pull out a piece of notebook paper. Pull out a pad. If you have a folder, a professional folder, do that. Don't bring out a scrap of paper and a cheesy pencil that you chewed on. You want to look sharp, be sharp. You're representing yourself as well as representing athletic training. I realize on this particular slide that it's a lot. So bear with me as I go through it. At your first meeting, hopefully you can meet at least for an hour. You want to pay special consideration to, is it a lunch meeting or a coffee break meeting? And in either case, be mindful of what you are eating and drinking. Obviously, a lunch meeting, there's an opportunity to have an alcoholic beverage. Do not do that. And be aware of what you're eating. Salads can be messy, and you don't want a messy sandwich. So if you're eating, I would plan to eat either ahead or later and just get something a little bit that you can munch on, because most of your meeting is going to be concerned with the business at hand. After you've made the introductions and you're face to face, whether you know each other or not, now is the time to ask your person, what are you looking for? What do you think will benefit your agency? Why am I here? So some particular questions that you can ask are, how do they currently work to keep employees healthy and on the job? What are they doing now? Do they have annual physicals? Do they do blood pressure checks frequently? Do they have health fairs? Do they have lectures from healthcare professionals coming in to give information to their employees that they can take home and work with it? And does this work for them? It's all good to have something on paper that they're doing, but does it actually work the nuts and bolts of what they intend it to do? How do they currently strive to reduce their medical and overtime costs that are due to injury and illness? Do they work to keep people at the station if they're restricted to what they can do? In some areas, you have medical leave, which is your employee is at home because they cannot drive, they're post-surgical, they're post-injury, whatever it is, they cannot get to work. And even if they did get to work, they can't do general paperwork jobs. Then you have restricted duty, where the employee can go to work and they can do modified work, but they are not allowed to dress in any kind of uniform or wear any kind of badge to denote that they are public safety, because you don't want a civilian person thinking this person can actually help them when they physically can't. So based on that, some agencies have taken their restricted duty people and required them to report to a work site and to perform some basic menial types of jobs. That's because studies have shown that an employee who is out of work more than 4 to 6 weeks really may not want to come back to work, so they're not eager to get back to work. So if you can get them back to their work site, even though they're not able to go full duty, it does encourage them to get back to work sooner. And it's also a way to encourage them to get into their fitness room or to meet with their healthcare provider, whether it's physical therapist or the athletic trainer, hopefully the athletic trainer, and go ahead and do daily work, daily fit routines, daily therapy, daily rehabilitation to get them work back faster. So what are they doing now? And again, does it work for them? Is there a fitness program, strength and conditioning program? Many areas do have required fitness programs, but many do not. So who manages the fitness program? Is it successful? Just listen. Listen to what they're saying. And as they're talking, let your thoughts tumble around in your head. And this is why you want your notebook paper, so you can jot some notes down of some points that you can make when they've completed their overview of what's happening there. To whom are injuries referred? In some cases, it would be to an occupational health physician or an occupational health office where there are physicians, nurses, PAs, or it could be one physician, the occupational health physician, who then makes the referral to the specialist, the neurologist, the orthopedist, the general surgeon, however the medical condition takes them. And is this somebody that works well with the department? In some cases they do very well, in some cases they don't. And in the cases either way, the athletic trainer can be a great blending for the worker into dealing with the physician. Are they happy with case management from workers' compensation? From the point of injury on the job, the injury report is generated and the workers' compensation adjuster receives that paperwork. Then through that adjuster, appointments are making with specialists, with rehabilitation programs, therapy programs, either with the athletic trainer or with a physical therapist or an occupational therapist, depending on what's needed. Are they happy with case management? In some cases, the workers' comp individual can be so overwhelmed that they lose the worker. So supervisors think, hey, this employee is still not able to work full duty, and nobody's been keeping up with them, how they're progressing. They may be progressing well, they may be making no progress, they may not be progressing, and nobody knows it until they go to their physician visits 6-8 weeks down the road, and then you have a delayed healing time or delayed care time. So with the athletic trainer in the mix, the athletic trainer, we're all used to case managing. In fact, we probably over case manage, according to some people, but the injured person mainly. But that way, the employee is on the horizon of the athletic trainer, knowing what their progress is and can report that with accuracy to the physician as well as to the supervisor. Is there a vision of how an AT would benefit the agency? So thinking that this person has read your packet that you gave them, have they had some thoughts about how an athletic trainer might benefit the agency? And just listen to what they say. Maybe or may not you agree, but again, hear where they're coming from, and then you can give your thoughts. Invite this person or any representative they'd like to send to visit an athletic training facility or clinic. It doesn't matter if it's a high school, college, professional sports, it doesn't matter, but bring them in so they can see that you actually are a healthcare provider. You're not a personal trainer. You're not a strength and fitness trainer. Bring them in so they can see the care, the equipment, the facilities, posters on the wall, all health related, all positive messages that you can be better than what you are. You can heal. You can manage to move beyond this. It's a great visual. I invited the captain that I was working with. After we had our lunch meeting, he came over to my high school facility, which I have to say was pretty well provisioned thanks to fundraising and other things. That's neither here nor there. And so he's walking around, he's looking at different things, he's talking to some of the young people there, talking to some of the coaching staff. Because when you bring a police officer into your facility, everybody wants to know what is a police officer doing there, especially a captain. And then he says to me, he says, well, I don't know if you knew, but I played baseball in college. So he sandbagged me because he already knew about athletic trainers. But he hadn't been to college for 20 years. So in that case, sports medicine had just made remarkable steps in their healthcare. And it was a good visit having them come. So have them come to your world and see what your world is, because you're going to have to mesh with theirs. Bring them in, give them a visual, and then they can take that back with them. It's also helpful to share contact information of athletic trainers who are already working in public safety and who are willing to answer questions. If you do that, make sure you contact that athletic trainer ahead of time to see if that's okay and to give them a heads up that they may be getting some requests for information. And last but not least for this meeting, follow up with a thank you to each person you met. Doesn't have to be anything exquisite, just a nice little thank you card, a nice little thank you note. A card will gain you more points, so, be smart. Just a quick comment regarding facilities. You may get asked in that initial meeting how much space you might need for a clinic and what are the requirements for that clinic. And I think all of us have been through, either in the university setting in our classes or practically on the job, have set up our athletic training facilities. But a good resource is the BOC Facility Principles that was updated March of 2015. Gives you a good outlier of what you actually need. They may ask you for a ballpark figure. That's up to you to determine, and it's important to be creative and look for donations from local universities, high schools, professional sports for some of your hardcore equipment facilities, your tables, perhaps, maybe even a hydrocollator or two. But be aware that you may get asked for that. And some of the minimum equipment is a 24-hour, 7-day-a-week cell phone and printer, scan, and fax machine. Nowadays, your physicians still like to have faxes. They don't like to email information. And again, that depends on your facility and your setup, because there are some secure transmissions, but not everybody has them. Should you be fortunate enough, hopefully, that your proposal moves to an actual conversation of hiring an athletic trainer for that agency, the next important thing to understand is who actually comes to the table for that hire. Typically, an agency just can't say, okay, we're going to hire you and that's it. There are a lot of hoops to jump through. So some of the people that are involved are listed here. And it's quite a varied group, and government does not work quickly. This is a slow process. So you want to have patience, and you may or may not be involved in this. It's doubtful that you would be. So it's important that your advocate clearly understands the benefit of an athletic trainer with that department. Again, saving money is the bottom line. So your department advocate would be there, and they will likely speak to the benefit of having an athletic trainer with the agency. The chief of the department, the fire chief or the sheriff or the police chief, they should also be there, and they should be supporting the department advocate. The department advocate should already have had this conversation with their supervisor. It should not be a surprise to the supervisor. So those two should be on the same page. The city or county attorney, there will be an attorney involved along the line. They represent the legality of the Practice Act as well as the liability interests of the agency and the locality for hiring an athletic trainer. This should not be a difficult issue, but it may request some information from the athletic trainer, your state board, the health professions board, or the medical board of your state as to what the liability is as well as what the legality is of hiring an athletic trainer. So it behooves you to be upfront on this and have that Practice Act already printed out and given to your department advocate. Human resources will be there. They're the ones who devise the contract and look at the relationships of the athletic trainer with the different groups within the agency. Workers' compensation will be involved to see if this athletic trainer is going to complicate their world, and actually it should make it better. The occupational health physician will be there. A representative with the workers' compensation panel will be there. If it's a large entity, that may be taken care of by human resources or a risk management person. But either way, the occupational health will be represented. In some cases, the occupational health will be a physician, or it may be a multiple physicians with a director. The athletic trainer needs to be very aware that these folks are, and rightfully so, territorial, and they don't want an athletic trainer coming in trying to change what they have. They want the athletic trainer to work with them. And down the road, if the athletic trainer sees something that would benefit occupational health or the panel, then that's for another day. But at this point in time, the athletic trainer needs to understand that they are not physicians. MD is not initials past their name, and they are to collaborate with the physicians, not make decisions for the physician. Also, as a point of information, in state law, the physician is the one who signs the employee back to work, and also is the legal person who takes the employee off work. The athletic trainer can recommend the employee go off work until they see the physician, and most of your supervisors will agree with that. But legally, it's the physician who makes the determination off and back to work. There'll be budget planners involved. These are the ones who are taking a look at what is the cost for a facility as well as maintenance of that facility, and what is the salary going to be, and what benefits are there going to be, and how much is that going to cost the locality. The union may be represented, may be represented if it's applicable. In a meeting I was at recently, the union was there, and it was very exciting to hear that in meetings they had been going to with their members, talking about budget, that there was already an underlying swell of excitement that an athletic trainer may be coming to be with them in their department. That was so exciting. And again, I think a lot of that comes from your employees being active people in their history and having run into an athletic trainer either themselves as an athlete in high school or college, or perhaps their children are being seen by athletic trainers in their schools. And then there will be, in the final approval process, a ranking government official. It could be the city or county executive, it could be a deputy mayor, it could be the mayor, but there's going to be a ranking government official that has to put their stamp on, yes, that this is a good idea. As the process moves on for hiring, one should keep in mind that it will take time for the contract to come to be, as well as the hiring process to take place. And while all the entities may agree that an athletic trainer is a good hire, it depends on where the fiscal year may be. So if the athletic trainer is looking for a hire right away, say January or February or whenever, September, keep in mind the fiscal year starts July 1, so they may not have budgeted for an athletic trainer. However, they may have budgeted for a contracted position, and the athletic trainer could, if they have a mind to, do a independent contracted position for a period of time until a formal hire contract can be made at the beginning of that fiscal year. So something just to keep in mind. When it comes to the contract, there is a lot of information that a new person receiving a contract needs to keep in mind when they're coming into an entity. And actually, it behooves all of us to know this information about our contracts ahead of time. So here are some tips about your contract. There are numerous resources in human resources at agencies about the contract, people that you can call and talk to, as well as certain athlete trainers in your area that you can talk to, or anyone that's employed by the agency, you can chat with them. So here's some specifics on the contract. Basic job information should be in the contract. The title of the position and the department for whom you will be working, as well as to whom one reports. There should be information about how that person in that position will be evaluated and how many hours a week that one is working. Also information about overtime. Is overtime required? Is it optional? And what is the rate of compensation for overtime? Compensation and benefits. Typically, the annual salary or hourly rate is listed. Again, what is the overtime compensation? There should be information about raises, bonuses, incentives, and how one can obtain them. There should be an explanation about the benefits plan, and that includes medical, dental, eye care, insurance, what percentage of the benefit the employee pays, and what percent the employer pays. There should be information about a 401k plan, deferred compensation, stock options if appropriate, and any fringe benefits. Then additional benefits. These are things that you can request to be part of your contract. All agencies, public safety, have to have training either annually or biannually, and that helps keep up their law enforcement certification and fire certification. So it only is appropriate that your employer pay for your training to make sure that one keeps up with their continuing education units needed for licensure and certification. And that includes travel, hotels, meals, per diem, to workshops and symposium. You can also request that they pay for your annual dues to the NATA if you would like, and perhaps any professional magazines that you feel be appropriate for your position. And the last item we're going to talk about in this section has to do with determining your salary. It's an important tool to be able to speak knowledgeably about what you are seeking to gain financially. Typically, salaries are based on years of experience, level of education, skill set, and the location of employment. Administrators who are determining your salary will also look at athletic training salaries in nearby communities. However, they may not consider professional athletic trainers. They may consider those salaries are not realistic in line with what your duties will be in your agency. I tend to digress, but that's just the standard that I have been told. Be realistic in your ask. Don't set your request too low or don't set it too high. What is the cost of living in the area? That needs to be considered. And what's the transportation going to be like to get you to your position and home? If you feel the salary may be too low, take a look at what the benefits package might be. In some cases, your benefits package may equal half of your salary. So while you're getting a particular salary, the reality may be getting a salary and a half because of the benefits package. And it's a good idea to take a look and utilize the NATA infographic in the February NATA news. 10 tips to use when negotiating a new salary. I think you'll find that quite helpful. I appreciate your time and attention during this presentation. You may find some more information by reaching out to the Public Safety Athletic Trainer Society website, www.psatsociety.com, and by taking a peek at our Facebook page, Public Safety Athletic Trainer Society. Their athletic trainers and those interested in public safety athletes share information. I have enjoyed sharing this information and my experiences with you. Good luck on all of your travels. My contact info is on the following slide, and feel free to reach out at me anytime.